Hi, and welcome back to Prescription for Healthy Lifestyles. And of course, joining me here is Dr. Daniel Potts. Hey, Danny.
Edie, good to see you.
Good
nice
to see
be back
you.
With you.
You know, we're talking about kids with cancer in the show today, and it's a tough thing to see kids go through any type of cancer, isn't it?
You know, a sick child is so hard to take, but especially cancer affecting a child. Out of these stories, though, can come hope and inspiration as well.
You know, with Stephanie and Courtney Alvis in the shows today, and I was thinking of a mother and a daughter, and how the daughter was stronger than the mom, and not that the mom didn't have the strength, it was just she didn't want to see her 16-year-old girl go through this cancer. And you have had experience certainly being a medical doctor with kids then at unit.
Of course I have. You know, Children's Hospital of Alabama is a wonderful facility, and they take such good care of kids. Not only do they take good care of the kids, but also the families as well. And you know, these families can be devastated as caregivers and seeing their child go through these illnesses.
Well, and that's what I saw, was that, you know, the nurses and everyone there becomes a team, but they're an extended family.
That's exactly right. They have to be, and they want to be.
That's exactly right. You got to have the right people. You want to be a person that helps someone to be a good caregiver for that person. But for a kid to say, hey, I'm ready to go back for my chemo, that's right. Saying a lot, isn't it?
That is amazing. And you know, the physicians there not only are wonderful caregivers, but they also are wonderful researchers as well. And they do cutting edge research in cancer and many other entities there at Children's.
Dr. Frederick Goldman will be on too. Well, you won't want to miss what's coming up next.
You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts. We'll be back in a moment.
If you woke up with pain this morning, you are not alone. Estimates are that nearly 1/3 of Americans will experience chronic pain at some point in their lives. Optimal Pain Control by Franklin Pharmacy works directly with your physician to create a pain cream for your unique needs. Our staff of pharmacists has over 30 years experience in compounding. OPC by Franklin Pharmacy's custom formulas are created for you to maximize pain relief while minimizing side effects. From minor aches to severe neuropathic pain, let us be your partner.
Enjoy the latest books from Edie Hand, a portion of sales benefit charities such as St. Jude Children's Research Hospital. Visit www.ediehandfoundation.org or your local or online bookstore. Pick up your copies today. A Pocket Guide for the Alzheimer's Caregiver by Dr. Daniel Potts and his wife Ellen helps you understand this disease and get the best care possible. Go to alzpocketguide.com or any online bookstore for your copy. You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
It's all really about education. And I think there's one thing, if you have cancer, you'll probably know, you're as a cancer survivor, you can understand and appreciate your disease a lot better if you know what it's about.
Absolutely.
You're not as scared about it.
I mean, and when you go through it several times and you're able to keep hanging in there, you think, this can get better. This is not going to have to take me out. I'm going to do what I need to do to fight for me.
Right.
And I think that's what, you know, having physicians like you makes such a difference too. And as children that are in those younger ages that are making choices, that are having the courage to go through what they're going through, but they need physicians like you that have caring hearts. And so I appreciate you.
Yeah, well, I appreciate you too. But, you know, I always tell people, when they say, Dr. Goldman, how can you care for kids with cancer? That's got to be the worst job in the world. And I kind of smile and I said, no, it's actually probably one of the best jobs in the world because, you know, you get to really make a difference. But who would you rather be, the patient or the doctor, you know? And I say, I got the easy job. The hard job is the one that's sitting over that chair.
Yes.
Right?
Yes. It's true. Yeah. I mean, when you've been on the other side of that,
Sure.
And something leads us all to have passions to do what we do. Mine is giving a voice back to people like you and to our patients to say, and to give those patients out there hope. And that's what our show is about, is to encourage people and to educate and to say, you're not alone. And so I know that's part of your passion, obviously, of why you do what you do, is you're making a difference for these kids every day.
Yeah.
And you know, I know there's a lot of research out there, and this you talked about was the Stem Cell Institute. So tell us a little bit about that.
So I had earlier alluded to finding safer ways to do a bone marrow transplant. Yes. There are new therapies out there that are being developed every day, and some of these entail utilizing stem cells. And I already told you that bone marrow and cord blood are a form of a stem cell. but we can also make stem cells from a person. And one of the areas that I'm working in is an area it's called regenerative medicine, where we're able to actually make stem cells from a normal person or a person with a disease, and we can take those cells and make them actually go backwards in time and create stem cells from a person's mature cells in their body. And then we can fix the disease oftentimes within that cell and then give that cell back to the person, which might be able to cure their leukemia, cure their immunodeficiency, or in some sense, if we get good enough in the future, we may be able to fix somebody's kidney or pancreas. And somebody who needs diabetes or who needs insulin for their diabetes may be able to get, in a sense, homemade created stem cells from their own body. And so this is stuff that sounds science fiction. Dr. Towns, who heads up the Stem Cell Institute here at University of Alabama, Birmingham, he is the leader of the program, and he and I are collaborating together on an important project that we hope someday will lead to the cure of sickle cell disease using this new novel therapy. But sickle cell disease is only one of the many diseases that this has application to. And
this is fascinating stuff.
And I feel very blessed that that I'm down here with so many smart people and can work together. But I've come from other places in the country, and I can definitely say that we here in Alabama are blessed to have a children's hospital, a very supportive hospital like we have, and the Stem Cell Institute and the university to help us, advance the field of medicine and in cancer.
You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts. We'll be back in a moment.
This is Holly, or Miss Clemente as her students call her, and they call her often because she's always there for them. No problem is too big or too small, because to Holly, you can't teach someone if you don't connect with them, and you can't connect with someone unless you truly care for them. Sometimes success starts when you go the extra mile to make sure someone else gets ahead. Virginia College, your success starts here.
Hi, I'm Sarah Evans here with friends Rollins and Kumar, who've been helping Children's of Alabama celebrate its 100th birthday. They're here for care at the Alabama Center for Childhood Cancer and Blood Disorders, the largest provider of cancer care for children and young adults in the state. At Children's, we treat every form of cancer, and we're committed to a cure. You can be too. Donate now so thousands of kids like Rollins and Kumar will celebrate lots of birthdays, including their own.
Hi, I'm Edie Hand.
And I'm Ronnie McDowell.
And I'm Georgette Jones.
Together, we'd love to ask you to support the Children's Miracle Network Children's Hospital.
That's right, Edie. Your local children's hospital provides state-of-the-art care, life-saving research, and preventative education for children 24 hours a day.
And we need your support to continue helping make life better for others. Just log on to childrensmiraclenetwork.org. We believe together we can have those miracles.
You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
But I've got a sweet young lady and her mother here, and we're here at Children's Hospital with us, and we have you, Courtney, and Stephanie, and thank you both for being with us.
Thank you.
Well, I guess Children's Hospital, folks really don't understand just how special Children's Hospital of Alabama is, do they?
Exactly. No, I didn't understand until I got here.
You got sick and had to come here.
Exactly.
And now it's like a family, huh?
It's home.
It's home. Well, what I loved about when you talked about what it was like for you that you got sick, you were at home, right, when you found this situation, or what happened to you? Tell our viewers exactly what happened. Even Mama, she'll be okay.
I realized it first when I was in my PE class at school.
And how old were you then?
It was last year, so I was 16.
Okay.
I was starting my junior year. And in PE, we would run around the track. And this had been happening for weeks now. I was in shape enough to run around the track. And then I kind of got this sharp pain, like that out of shape pain in my right rib. And it just continuously got worse. And then it got over like a week, it felt like somebody was sitting on my chest. And just having a conversation like this, I would get out of breath and try to have to catch my breath. And so we went to my regular doctor, and they took x-rays and listened to me breathe, and they never really said anything. You know, they talked about maybe having to put a needle in my right lung and blow it up. Like,
but
they
it
thought
didn't sound too good.
They thought, and I started crying about that because I'd never had surgery before, and so they just thought it was going to be a little small thing. They thought my lung was just deflated at the bottom because on the x-ray one was white and one was completely black, and so I knew something wasn't right. So they sent me to Children's, and I stayed in the emergency room for like 8 hours, and I had the lung doctor come in, and you know, it's a learning hospital, so you have interns and fellows and all of these doctors asking me the same story, the same questions, and then finally that night the oncology department came in. And they told me that it might be lymphoma, it could be leukemia, they were going to do tests, and the next morning I went to surgery. And
that was scary for you, wasn't it?
It was, because it was
scary
a lot.
for you, Mom?
Oh yes, absolutely.
Okay.
It was overwhelming, I suppose. And then something happened in the surgery, and I ended up having to be in ICU for 3 days on a ventilator. And that was really tough for me because they couldn't put me to sleep. So I was fully awake on the ventilator, like writing notes and telling them I wanted this thing out because it was terrible. And once I stayed in the hospital for a week after I got out of ICU after 3 or 4 days. And it was just, I've learned these people have just come to be my family. And
because they took such good
care of me. Yeah, and so I came for 10 months every Tuesday to get chemo.
And Mom, what was that time like for you and your family?
Well, let me say about the staff here. You know, I've told them before, to see how much they love your child, you can't help but love them back. And they made us feel, as parents, that my child was the only patient in the hospital. And that's very hard to do, you know, in a hospital this size. So you can't help but
love the extended care that you've gotten into these people, and they become like your family. Well, I'm sure it's been very difficult, a hard year for you.
Yes.
And it's great to see you both here and to see how well she's doing.
Yes.
That Courtney is making such great strides. You know, the things that we've learned about through cancer and cancer research is that don't give up.
Exactly. You can't, I mean, there's nothing else you can do about it, so don't sit in your room and cry about it.
Cry and get over it.
I guess.
That's right. It is, and you have such an array of it around you, and you know, just seeing you and how well you look, and knowing that there is great things ahead for you, and with parents like this, you know, having great support, not just from the nurses, but it sounds like you got a pretty cool mom and dad.
I do. They've always been there. I mean, this whole experience has just made us so much closer. And that's
and you have a younger brother, you said?
I do. His name's Caleb, and he's been really supportive. Like, some days when I first started going back to school, I couldn't open my locker and carry my books, so he would be late to class, but take me to my class, you know.
How sweet.
He's really taking care of me.
Well, that's great, and I'm glad you told me before we went on the air that the kids were great to you at school, too.
They really have. I've had a good friend through all of this, Spencer, and she's organized things at school, like posters, and everybody sign them, and, you know, just different activities and creative things like that to bring to me, because when I was at home, I couldn't go to school, and I couldn't go anywhere else, but she would come by and bring me posters, and it just made me feel like those people at school didn't forget about me yet.
Well, they'll never forget you. You see, because I can see that you've made an impression on the nurses, on Children's Hospital, and now you're a voice for other young girls that are going through tough things. Because, you know, it's important for us to feel good on the inside as well as on the outside. Mm-hmm. And I see that your mom's helped do a very good job of that. And if you could, you know, it's what you're going through now. Now, tell me exactly what your diagnosis is.
I have acute T-cell leukemia. And leukemia is like in my bone marrow and in my bloodstream, so it's a type of blood cancer.
So with what we've talked about with Dr. Goldman and talking about some children that require a bone marrow transplant. But right now you're not a candidate, is that correct?
I'm not, because my body is no longer producing cancer cells. But I'm still in maintenance, so I still come once a month to get chemo to keep it that way.
You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts. We'll be back in a moment.
Sure, Toyota is #1 for everyone. But Scott Crump insists on more proof than just statistics. Yeah, the all-new redesigned 2012 Camry has more room, better fuel economy, and plenty more performance. And right now at Scott Crump Toyota, you too can drive the new Camry from just $199 a month. Did we mention better brakes? Visit Scott Crump Toyota in Jasper.
We'll do whatever it takes.
Enjoy the latest books from Edie Hand, a portion of sales benefit charities such as St. Jude Children's Research Hospital. Visit www.ediehandfoundation.org or your local or online bookstore. Pick up your copies today. A Pocket Guide for the Alzheimer's Caregiver by Dr. Daniel Potts and his wife Ellen helps you understand this disease and get the best care possible. Go to alzpocketguide.com or any online bookstore for your copy.
If you woke up with pain this morning, you are not alone. Estimates are that nearly 1/3 of Americans will experience chronic pain at some point in their lives. Optimal Pain Control by Franklin Pharmacy works directly with your physician to create a pain cream for your unique needs. Our staff of pharmacists has over 30 years experience in compounding. OPC by Franklin Pharmacy's custom formulas are created for you to maximize pain relief while minimizing side effects. From minor aches to severe neuropathic pain, let us be your partner.
You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
We talked earlier about the importance of cell transplant, stem cells transplants, and we've talked about the different programs that this hospital has. I also know that you're a professor and you consult with a lot of these physicians and in making a difference in the paths they take for these children's diagnosis and what their treatment should be. So would you kind of give us an overview of what we've been talking about today and that might would help some folks out there looking for these services?
Well, you know, the Children's Hospital here of Alabama offers many services. Now, I'm a pediatric cancer doctor, and so that's my specialty as far as the services that I can offer, and specifically bone marrow transplant. There are other services, of course, throughout the hospital, all the different subspecialties. You know, there are specialists in cardiology and pulmonology and gastroenterology. It's a full service children's hospital. I'm very proud to be a part of it. To be a certified children's hospital, you do have to have all the subspecialties underneath your roof. And in addition to the medical specialties that I mentioned, you have to have the surgical specialties, the neurosurgeons, the general surgeons, the specialist surgeons, you might say, as well as an emergency room department, and everything to provide all the care, including care of neonates, of little babies and premature babies. So all underneath our hospital's roof are the services that encompass these wide number of specialties. I don't exactly know how many doctors are here at Children's Hospital.
But there's a lot.
Well, there's a lot of doctors, and there's a lot of hospital beds.
And I know that with the new facility too that we've talked about on a couple of other shows, it's going to be in 2012, that you're going to be able to have a lot of things under one roof that you've never had before.
Yeah, it's again, we're blessed to have this hospital. You know, not every state even has a children's hospital within it, and so you know, the nice thing about a children's hospital is, as you said, all the specialties, all the resources are right there, much more closely situated, more available to you, and it does improve the care of children. It makes it better, more efficient, and certainly the quality of the care is better.
I know that these kids that have to have these bone marrow transplants, I know that it's tough on not just the child, but the parents and the extended family members. And how does your whole team seem to work with it? We talked about that a little bit in the early part of the show.
Yeah, well, we have special services that are really necessary for us to be able to do what we do. You can imagine being isolated, and our children and our families are isolated in an area. I mean, because of their immune systems, they're not able to go out. outside of the doors, our lockdown doors. And so that can lead to some stir craziness. And so, we offer all sorts of services for the families and the kids to try to, be as amused as they can be, to be as healthy as they can be, and to also understand, the spiritual and psychological aspects of what it takes to care for these folks. Some people come into transplant one way and leave another way. There's a transition of people's health sometimes, and also their psyche. And our goal is always to make people better and back to the way they were. But it's a process, and that process is a genuine strain. And so we anticipate these things often, and as I said, there are support systems that we have in place. We have wonderful child life specialists, wonderful people that are volunteers that come to the hospital and spend hours on a day just sitting in the room, if nothing else, just watching the kids as they watch TV, or they'll color coloring books with them, or make models.
And they're toys. I mean, I also know that people out there that want to be able to give back. I know that during the holiday season is that they can't just be any toy just brought in this hospital. It has to be approved if you're going to give it to a kid with cancer. It has to be something new and approved. I mean, that's different when their immune system's down, isn't it?
Yeah, I mean, they can't have fluffy toys, things that can't be washed, things that are dusty. And so there are specifications on what they can give, but I think any giving is great.
Yeah.
If not for a child on the cancer unit, a child
on the other floor, right?
And so it's always amazing to me when you see the holiday seasons how many people come out. And again, the one thing I'm gonna give a pitch here for the local Alabama people, and that is I've never seen such a giving community. I mean, when the holidays come around, there are more groups of dedicated, I'll use the word philanthropists, that come by, that see the kids, donate money, donate time. I would say that this is a one-of-a-kind place. And I've been at other places in the country, but this really is remarkable to me. And it's maybe, we talked earlier about the spirit, the spirit of
giving and the spirit of the South and of giving back. And I just want to thank you for giving of your time again today and for being on this show and what you're doing to make a difference for children.
Well, Edie, we've had a great time talking about Children's Hospital of Alabama and inspiring stories about childhood cancer and those that take care of kids.
Yes, it's always encouraging to see what not only is happening at places like in Alabama Children's Hospital, but around the world, of the children's hospitals that are making a difference for our kids through research and the support systems of caregivers.
Folks that take care of kids are special people.
Yes, and I hope that people will tune in to see more of our inspirational shows and to learn more from physicians like yourself that really have the compassion for the fellow man.
We hope you'll join us again for Prescriptions for Healthy Life.